You probably know her name, Florence Nightingale, the lady with the lamp, the angel of the Crimean War, gliding through dark hospital wards at night, holding a light for dying soldiers. That image is real, but it's also one of the most successful acts of erasure in the history of science. Because the thing that actually saved those soldiers, the thing that changed military medicine, hospital design, nursing, and public health policy forever, wasn't a lamp, it was a chart. Not just any chart, a circular, color coded, mathematically precise diagram, one that made the government's failure so visually undeniable that it couldn't be ignored, denied, or buried in a report no one would read. And that raises a question her story forces us to sit with. If you have data that proves people are dying unnecessarily, what does it actually take to make the people in power see it? Florence Nightingale was born in 1820 into a wealthy English family, and in that world, wealthy women had one job: marry well, manage the household, and stay out of public life. Her father had different ideas. William Edward Nightingale was a Cambridge graduate who believed his daughters deserved the same education as any man, so he taught Florence mathematics, Latin, Greek, and history. By the time she was a teenager, she wasn't just learning, she was thinking statistically, organizing observations into tables, looking for patterns in numbers, while other girls her age were learning to pour tea. But education without outlet is its own kind of prison. As a teenager, she experienced what she described as a divine calling. She believed she was chosen for a specific purpose: nursing the sick. In Victorian England, that wasn't an aspiration, it was a scandal. Nursing was seen as work for the poor and desperate. For a woman for her class to enter a hospital ward was simply unthinkable. Her mother was appalled, her sister was baffled, and the family spent years, redirecting her toward marriage and social life, the future they had planned for her. Floritan spent most of her 20s and early 30s in quiet desperation, educated enough to see exactly what she wanted, and blocked at every turn from getting there. She wrote about those years with devastating clarity. She had the mind built for work and nowhere to put it. When she finally got access to formal nursing training, first in Germany, then with the Sisters of a Charity in Paris, she was already in her 30s. Most women in her position would have given up long before that. She didn't give up. She studied, she observed, she took notes on hospital administration, time management, how care could be organized systematically rather than left to chance. And she kept her mathematical mind sharp. During this time, she moved in intellectual circles that would shape everything that came next. She corresponded with Charles Babbage, the computing pioneer. She worked alongside Sidney Herbert, the secretary at war. And she encountered the ideas of a Belgian statistician named Adam Quetelet, someone we looked at in our earlier episode. Quetelet had argued that social phenomena follow mathematical laws, that if you collect enough data, patterns emerge from what looks like chaos. Nightingale looked at that idea and pushed it somewhere she'd never taken it. She turned it into a weapon. In October 1854, the British government sent her to the Crimea. The war against Russia wasn't going well, not because of the battles, but because the hospitals were killing more men than the enemy. She arrived at the Barak Hospital in Suturi in November. What she found was almost beyond description. Wards without beds, patients lying on floors soaked in sewage, no clean water, no basic supplies, no cutlery, rats, fleas, the smell of infection everywhere. And the records? The records were perhaps the most devastating thing of all. Every hospital used different names for the same diseases. Death went undocumented. Men disappeared into the ground without a single number to say they'd existed. She was a woman in a military institution run entirely by men who hadn't asked for her. The doctors resented her. Her authority was informal. Her access conditional. Her suggestions treated as interference. She had no rank, no formal power, no way to make anyone listen. What she had was data. She started collecting it immediately, working with the medical statistician William Farr to bring order to the chaos, and what they found was staggering. Of the 21,097 British deaths in the Crimean campaign, 16,323, that's more than three quarters, weren't from Russia bullet. They were from preventable infectious diseases. Typhus, typhoid, cholera, dysentery. The hospital itself, the place that was supposed to save men, was killing them faster than the battlefield. The annualized mortality rate peaked in January 1855 at the level that, if it had continued, would have eliminated the entire British army within a year. Not from combat, from the conditions they were living in. When the Sanitary Commission arrived in March 1855, improved drainage cleaned the water, flushed out the sewers, the mortality rate collapsed from 42.7% annualized to roughly 2%. The evidence was unambiguous, and nobody in power was reading it. This is where Nightingale's genius goes beyond medicine or statistics. It becomes visual. She understood something most scientists of her era didn't. Data on its own doesn't move people. Tables of numbers don't produce outrage. The Victorians called their government reports blue books, and those blue books sat unread on parliamentary shelves while men kept dying. To change policy, she needed to change perception. And to change perception, she needed to make the truth visible in a way that needed no translation. So she built a new kind of chart. She called it a diagram of the causes of mortality. We called it the Rose diagram, or more formally, a polar area chart. It's circular, divided into 12 wedges, one for each month of the year. The area of each wedge, not just its length, but its actual area, is proportional to the death rate that month, and each wedge is split into three colors: blue for deaths from preventable infectious disease, red for deaths from battle wounds, black for everything else. She adapted this circular structure from a format used earlier by statisticians, including Curie in 1829 and Farr in 1852. And Farr, importantly, worked directly with her. But what she did with it went far beyond borrowing a shape. She made it mathematically rigorous, using a precise formula to make sure the visual area of each section truly represented the data. She made it impossible to misread. When you look at it, the truth hit you immediately. The blue sections, preventable disease, were enormous. The red section, battle wounds, were almost invisible. You didn't need to understand statistics to see what it was saying. You just needed eyes. Now, if you've ever worked with climate or environmental data, this circular structure might look familiar. The wind rose diagram used in meteorology and climate science to show wind speed and direction uses exactly the same polar area logic. Circular wedges radiating from the center, magnitudes encoded in area. These two charts weren't designed together, they developed independently, but they share a structure because they are solving the same problem. How do you show cyclical or directional data so that patterns are instantly visible? Nightingale built a framework for seeing that was so powerful. Scientists in fields she never imagined are still using it today. She didn't stop at the rose diagram either. She developed bad wind charts to show the collapse in mortality after sanitation reform, honeycomb charts to illustrate how overcrowded military camps were compared to civilian London, and line charts using the thin red line imagery to show that British soldiers were dying at twice the rate of civilians the same age, even in peacetime, just from the conditions they lived in. Every chart was an argument. Every design choice, the colors, the scale, the shape, was made in service of one goal, making the truth impossible to look away from. In 1859, she partnered with the writer Harriet Martineau to publish a book called England and Her Soldiers. They both understood that data alone wouldn't be enough, it needed a story. Martineau wrote the narrative, Nightingale supplied the data and the diagrams. Together, they took what had been buried in government reports and put it in front of the public. And the government could no longer pretend it hadn't seen. The consequences were permanent. A royal commission on the health of the army was established. Lasting sanitary reforms were put in place. A new department for army medical statistics were created, and mortality rates in British military barracks, even in peacetime, started falling. In 1858, she became the first female fellow of the Royal Statistical Society, the same institution that had grown from the international statistical movement Quetelet helped inspire. In 1874, she became an honorary member of the American Statistical Association. In 1860, she founded the Nightingale Training School at St. Thomas Hospital in London, turning nursing from a disreputable trade into a rigorous, evidence-based profession. That model spread worldwide. Her work with William Farr to standardize how diseases were named and classified built directly on what Quetelet had started with his international statistical congresses. The disease nomenclature they developed together is the structure ancestor of the International Classification of Diseases, the ICD, that every hospital in the world uses today. But maybe her most enduring contribution isn't about nursing or sanitation at all. It's the demonstration that visualization isn't decoration. It's not about making data look nicer, it's about making the argument. And the most powerful arguments are the ones that make the truth feel inevitable the moment you see it. In climate science, marine conservation, renewable energy policy, this lesson has never been more relevant. Every IPCC report, every environmental impact assessment, every proposal to a government agency is fighting the exact same battle Nightingale fought. How to make decisions makers feel the urgency of something they'd rather not act on? Her answer is still the best one we have. Don't bury the truth in numbers, make it visible. Now, Nightingale's legacy isn't without complications, and I think those complications are worth being honest about. The rose diagram itself has a known structural flaw. Outer segment gets more visual emphasis than inner ones simply because of their larger area. A wedge near the edge of the circle looks bigger, commands more attention, even when the underlying data values are similar. The structure that makes this chart so compelling is the same structure that can quietly distort emphasis. And Nightingale knew that visualization was persuasion. She chose blue for disease death deliberately. Blue reads as vast, calm, an ocean of preventable loss. These weren't neutral design choices, they were rhetorical choices in service of a true argument. That's where her story becomes a warning as much as an inspiration. The exact same techniques, color, scale, circular framing, relative versus absolute magnitude, can be used to obscure truth just as easily as to reveal it. A relative scale can make a catastrophic trend look like a minor fluctuation. A color choice can make something urgent look routine. The design of a chart is never innocent. And then there's the myth. The lady with the lamp image wasn't entirely accidental. Victorian society was far more comfortable with a compassionate, nurturing woman than with a woman using data as political power. Tenderness was acceptable. Exposing government incompetency through mathematics was dangerous. The lamp was easier to celebrate than the chart, so the chart was forgotten for over a century. So, here's what I want you to take away from this. A visualization is not just a picture of data, it's an argument, designed it honestly. Nightingale understood that the gap between data and action isn't a statistical problem, it's a communication problem. She closed that gap by making the truth visual, rigorous, and impossible to ignore, while being systematically underestimated by the very institution she was trying to reform. In my own work with environmental data, I've seen the same numbers tell completely different stories depending on how they are visualized and what the author wants you to feel. Red creates urgency. Gray pushes something into the background. A relative scale can hide the true magnitude of a crisis. And this isn't always accidental. Sometimes it's a choice. Nightingale made that choice deliberately, and she made it in the direction of honesty. She used visual design as a weapon for truth, not a tool for comfort. That's the standard, she said. And it's the question every chart asked of the person who built it. Are you showing people what the data actually says, or what you want them to believe?